So, hello, Cheryl Elenari. I'm so glad to meet you for this interview for the Devilman Hypnosis Institute friends. And I'm so glad we met together and we'll met physically in May in Orlando. Um, as we were talking about Devilman's work and legacy, I would like to ask you a few questions today about Devilman hypnosis, life, and so on. So the first one is, according to you, what is the importance of Devilman in the history of medical hypnosis in the USA?
I would say it's getting the doctors to realize a few things. One, that hypnosis is a useful medical tool. Two, that your most efficient use of it in a medical office is with direct suggestion. Three, if you're going to do that, you must remain client centered. The client has got to be your full attention. When you're doing stage hypnosis, for example, for comparison, you the hypnotist, have to watch what's going on with your subjects, what's going on with the audience. So you're splitting your attention. In a medical office, you cannot do that. It must be client-centered totally. So it's client-centered, direct suggestion, and it's a tool that assists all of your other medical availabilities. Those are, I think, things that my father would have responded to your question.
Okay, thank you, Larry. According to you, what are the main findings in hypnosis of Devilman?
Okay. First and most important, it is the subject who is in control, not the hypnotist. For the hypnotist to think he's in control is a mistake. The result is, if you know that the subject is in control, part of your pattern must involve convincing the subject that whatever medical procedure you're going to use is to that person's benefit. You don't just say, you can't feel a thing. You have to say something to the effect of, you can't feel a thing so that we're able to do a better job on the operation. Whatever. I don't know quite how to phrase this because you caught me a little bit off kilter here, but basically that would be a major item. Another major item, which unfortunately he always provided by description rather than by as emphatically as I'm going to say it. And that is when somebody is in a hypnotic trance, whether it's light trance or whether it's as deep as going all the way to Esdale, they have complete logic and they are not asleep, they are conscious. They may not appear to be so because they may be ignoring you, or they may sociologically have been told that, well, when people are in hypnosis, they look like they're asleep. So, okay, I'm going to look like I'm asleep, but they are totally conscious and their logic works.
Maybe conscious is not the right word because you're talking about conscious versus unconscious or subconscious.
Okay, you're right. What's a better word?
Maybe aware, that they can be aware of everything you're saying if they choose to, but they can also choose to forget what you're saying, and let the subconscious take care of it. So I think that's more what it it was about and is about.
Better
So
choice of words. Thank you, my darling.
so being
Thank you.
client centered is absolutely 100%, whereas so many techniques that are out there are so script based that you're always using a script and not necessarily working with that client with their problem and just going back with that client. Another thing was that so many things in medicine, so many things the doctors were seeing, um, some of the diseases, some of the symptoms had nothing to do with the physical aspects of their body and was very tied into an emotional event that happened sometime in their past. And I think looking at that and clearing that, for example, the stuttering, you know, you know, even today still, I was talking in a class, I think it was in Sharon's class the other day. There was somebody that was a speech pathologist, and they do not go after the cause. When did this start? You know, children are not born stuttering. Something happens to create that. And usually it's being kept from giving a message of some sort or some sort of trauma. But they're standing there and still trying to get them to enunciate those words and trying to stop it at a physical level without taking away that emotional component. So I think that's where one of the big contributions or findings that Dave brought to it, that a lot of that stuff went to emotional events that created a pattern, that brings them to that migraine headache today, that brings them to that stuttering today, and that often all those events that lead up to it gave that similar emotion that created that headache. So the headache that they had yesterday is a similar component to how they felt when they got that first migraine headache, when maybe they were 8. So I think that makes it fascinating too.
My my father taught based upon what feedback he had gotten from the allergists who went through in the first several classes, that probably on the order of 70% of all allergic reactions have an emotional base. Well, I'm not sure if I've grabbed 70% today simply because food additives cause many of these, yet are hidden from the person. For example, I'm sure there's an additional additive in peanuts because when I was a kid, peanut allergies were rare. Today, they're common. We have not genetically changed the peanut, and I don't think we've genetically changed the human race. The processing has added something that people are allergic to. Fine. But the point is that 70% in the 1950s and 60s had an emotional component. I didn't say that they were totally caused by emotion.
So let me ask you, Brad.
Back to this.
Breeze, what do you think are some more of the key findings?
I would say that, of course, the regression therapy with hypnoanalysis is, as Develman called it, the crown jewel of hypnosis. So that is major work. But also, what's very interesting, he brought a lot of new techniques, in the management of the trance and all the different level of trance. He developed the waking hypnosis, somnambulic state by design, the Aisdale state by design, and the emerge from the Aisdale state, and also the hypnosleep. So he brought more than he brought a philosophy, but he brought also tools and techniques that can be very usable and very useful in our daily practice in the medical field. And that's very important because hypnosis is a philosophy, of course, of treatment, being client center, making regression when we need it to find the cause, but also we need to have techniques and we need to have tools to manage deep trance. And my idea is that as this hypnosis, this medical hypnosis of Dave Ellman came from stage hypnosis, it was one what the first and most powerful technique coming from the stage hypnosis, and it transferred them to the medical field. That's why it's so powerful, because it's coming from the somnambulic state management. And that's my experience as a medical practitioner, but also I made street hypnosis, and it's a very useful technique things that we use when we are practicing hypnosis in the street, because we learn a lot from this somnambulic state. And the main finding in hypnosis of Dave Elman are also this technical part of the trance, I think so.
And I think one of the key components is that little thing that we call fractionation today, that he
Yeah.
called 3 trips to Bernheim, was such a key factor that everything else started to rest on, because that was the key factor of taking what could be a long induction and bringing it down to that 1 to 4 minute. So his thing was 3 trips to Bernheim, where you you decrease the amount of time needed to put somebody into somnambulism. That
Yeah,
that made it so it was very usable in a doctor's office.
There are two points I'd like to make along these same lines. They're in agreement among all three of us, but I think they need to be out on the table. The first is the 3 items that got his course started. Committee of doctors asked him to teach medical hypnosis. He said, I'm not a doctor. Discussion of, but yes, but I'm not a doctor, but blah, blah, blah. And they finally said there are 3 things that you demonstrate on stage that are important to being medical tools. If you concentrate on those 3 things, everything else that gets taught in the course will follow, but they're to be your foundation. One was rapid induction. The hypnosis schools of the time, which all of the members of the doctors committee had attended, said you needed 20 to 40 minutes to achieve adequate depth. Here, my father is achieving it in a minute or 2 on stage. Second, the schools were teaching that only 40 to 60% of the entire population of the world could be hypnotized. Every stage hypnotist knew this was false. You get 95 to 100% on stage if you're any good. The third thing was, they said, we noticed you gave some post-hypnotics. To a physician, the post-hypnotic must have the same validity as the prescription slip he writes to the local drugstore. If you can get your post-hypnotics that reliable, you have a medical tool. So those 3 things were what founded the course. You look at all the other things that we've discussed today, they all fall out of that as you get more and more doctors using the things. I mentioned allergies. You take the proper approach with a woman in labor, birth of a child, whether it's a human child or a child of an animal in the wild, is not meant to be disabling. Why is it that some tribes in the world, and I can name various countries where this is true, the woman goes into labor, she stops what she's doing, delivers, and goes right back to working, and has no problem. Yet here in America, it is an extremely difficult thing. The reason is sociologically. Once the obstetricians could see that, yes, these other things were not fables, they were real, they could start saying, how do I make a suggestion to assist the natural process? What do I do to make it work? So you have the expansion of hypnosis in childbirth. You have the expansion of hypnosis in surgery, and on and on and on. And each of these basically starts from the three items that I said were the foundations of the course and going on. The other thing that shows up as a result of this shows up in the way he taught the Dave Elman induction. It was taught to go from a totally unhypnotized state through trance and into somnambulism. And he would be asked, do we have to do the whole thing? The answer was no. If I'm going to do something very minor medically, I can stop with trance. I've got adequate depth. But the medical hypnotist needs to know to go all the way to somnambulism in order to have his choice, his or her choice. If I want to do hypnotherapy and I'm going to use regression, I need to go all the way. If I'm going to simply make an area numb so I can give an injection, I don't need somnambulism. I can get that in light trance. Getting the doctors to realize that we need to, at the medical level, need to know all the way to somnambulism so you have a full set of tools, but that you will use only those tools you need for the presenting problem that you're working on. That was a major concept for many of the doctors. I sat in class when I was a teenager and watched some of the, excuse my bluntness, some of the stupider doctors in the class not catch that point, but feel that they had to do things by rote, because in their medical school they had been taught always do everything by rote. No, you do things by logic, by what is appropriate. And so you'd have a whole bunch of students who'd pick up that idea from my father and use whatever tool was appropriate. And you'd have a couple of them in the class who would, I must only do this by the book. Bad mistake. I'm not sure if as a teenager I visualized it the way I've just described it. As a teenager, I'd think, he's stupid, he's smart. That's as far as I would think. But I had the good fortune to go to MIT. And at MIT, the philosophy parallels my father's philosophy. You need to know everything, but you need to pick what you need for this problem. And you need to be able to separate and combine. And when that was drilled into me at MIT, suddenly, bingo, light goes off in my head. Aha, this is what Dad was teaching. This is what Dr. So-and-so learned, but Dr. Such and such was too busy going like this, only on the printed page. So for me, the things I've just said are central to understanding. What I found interesting when I came out of retirement and began teaching hypnosis was the number of the good hypnosis teachers whose philosophy was the same as what I've just described. Learn everything, but use the piece that's appropriate. Use rapid induction. Why? I have a little saying I use. Rapid induction is its own convincer, because the subject is aware. Thank you for correcting my misuse of words before, because the subject is aware of the state he or she is in. The rapidity of getting there is a convincer. So anyhow, that's a sort of a squeezed out of the things that I take from what Dad taught me and from what I've done in practice. Oh, by the way, something most people don't realize is how useful hypnosis can be in the military. I retired as a colonel.
Yes, of course. And what is, according to you, the actual legacy of Dave Ellman in the field of hypnosis in the US?
What is the legacy? We
Yes.
all are the legacy. We are all the legacy. Uh, the 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 expansion of his concepts and his teachings into other people as they're developing their methods and winding and blending them in. Because Dave, if you looked at Dave's course on day one and you looked at Dave's course on year 12, they're going to be very different. The doctors were always bringing in new ideas and as Larry said, they would test them. And, it was great because he had working doctors out there with full loads of patients. Today we teach people hypnosis, except for you, because you're teaching a lot of dentists and medical. But the average person that's teaching hypnosis and the person taking it does not already have a full working clientele to practice these things on. So it seems that it's like a much slower slope. But here they would go and they would practice all week on some of the techniques and come back and report what to Dave what happened. And so from that they evolved new techniques and built on it, and it was like a metamorphosis of his original thoughts. And then he would come up with new ones, and as they were going through class demos and cases, different things would come up. So I think that that the part of the legacy is how we all use it, and it expands into different areas. And then from that expansion, other hypnotists are out there creating new techniques based on everybody's old techniques. So how many really new ones has been discovered. And so as a result from this, that makes us all the legacy of Dave Ellman around the world. Excuse me. Does that make sense to you, Bruce?
Yeah, of course. And you've created the Dave Ellman Hypnosis Institute, and I've created the same association in France, to promote and develop Ellmanian hypnosis in French in the medical field. And according to you, what is the future of the Dave Ellman Hypnosis Institute? Books publishing,
That's
training, congress, research in Ellmanian hypnosis?
Yes. So right now we're getting into publishing books. So, we've discussed a joint effort that we're going to do, and should be coming out this year. And I'm currently working on a compilation from. We had a Dave Ellman Legacy Zoom conference last June, and we had 90 speakers from 20 plus countries talk about their methods of hypnosis and how they were influenced by Dave Ellman. So I'm now writing a book called Evolving Hypnotherapy, the global influence of Dave Ellman. So taking taking his chapters, taking his information that he had out there in 1964 when he published the book, to what has been done now. How is it expanded, just like his class would have expanded in their techniques? How has his techniques been woven into today's hypnosis, and it put in people's toolkits? A lot of people think it's only the Dave Ellman induction. The
No,
Dave Ellman induction is about 30 pages out of a 330-page book. So I think it's important to go find out what's on the other 300 pages.
I think that the point should be made that the future of the Dave Ellman Hypnosis Institute in both countries is both teaching and publishing. It's not one or the other,
Right.
it's a combination. And it's an encouragement of those who have learned how to use these tools to cross pollinate. Remember the example I gave? I don't know whether it was during this discussion or an earlier discussion with you, of a few months before my father died, him orchestrating a test of a new procedure within hypnosis. When he got the idea for that procedure, it was one of his students calling in with, "I've just done such and such and it worked." What did he then do? He then said, "Let's have doctors A, B, and C try it in additional cities, removed from you, separate from you, not having had any contact, and see if they find the same thing. If they do, we then spread it." I've gone to hypnosis conferences. I find that the most useful portion of the conferences is not the classes that I sit in. I sit in a number of them. It's usually the discussions after the class among fellow hypnotists as to what can I do? How can I take what I just heard and use it in additional areas? It's the spreading. So it's publications, teaching, and encouraging intercommunication such that these ideas spread. Those are the three major components in my mind of what we should be doing.
And building trainers around the world, because what we want to do is have people continuing to teach this past our lifetime. So building a good working network of trainers that are well versed in the Elman techniques that will help keep it alive. I mean, if you think about it, it was Jerry Kine and Gil Boyne were very instrumental in keeping it alive, keeping the Elman legacy alive. And they're both gone. And Larry and I are here, and we've picked up the ball, and I think we've expanded more globally too because of our, teaching in 17 countries. And now we're teaching on Zoom, so we reach even more countries. We plan on doing another conference, probably winter of 2023, beginning of the year. Just have to figure out a date and say this is it. And I'm looking forward to. I think ours will always be a Zoom conference because, and trying to make it as much of a feel of a regular a regular conference, even having that component of being in the hall with our Dave Elman a cafe, which I think it's important because so many people are limited in having to travel to a conference. And our goal is to get those teachings out there to more people, and to expand it and let them, because they're so effective. We want to help hypnosis continue to be effective. So I hope that helps answer it. Did I forget something that you can think of for the legacy?
No,
Reese?
I think that's fine. That's very complete. And one last question, maybe something more personal. What is your best memory of your dad, Larry? I think you have a lot, but one picture that came to
Yeah,
your mind.
probably in one of the classes, um, trying to remain polite while informing some student that he had totally misunderstood what everybody else in the room had already figured out.
And Dave was he loved history, but he made it very interesting. So to him, history was the story of people,
Yeah.
and that's why I think he really instilled in Larry
And in my brother.
and in one of your daughters too. And the fact is that history is is the story of people, and so it makes it so. I mean, look, you have an 800-page book of history coming out. Oh my goodness! Look at all the stories of people that are in there.
I'm lecturing to the Pope.
Great. Thank you so much, Cheryl and Larry, for answering my question for this interview for the Development Hypnosis Institute France. And so glad, and we'll have time to talk more in May in Orlando for the Congress. So I'm so glad we meet there. It's going to be a good appointment and great Congress, I guess. So
Yeah.
thank you so
Yeah.
much.